Welcome, everybody, to the Junto Podemos webinar from LULAC National. We're here today to talk about testing with our esteemed guests. I will start with the lady, Sindy Benavides, LULAC National CEO, Dr. Cameron Webb, who's the Senior Policy Advisor for the COVID-19 White House Response Team, Dr. Ilan Shapiro, the he's a doctor at AltaMed and the chief health correspondent and medical affairs officer who's coming to us from Los Angeles, and Ed Hamilton, who's the president of the Southwest Washington State LULAC 47013. I'd like to open up the questions to Dr. Webb. Can you talk to us about the different kinds of tests available to people and how they should choose those tests?
Absolutely. Well, thanks so much for having me. It's an honor to be here. I think the testing paradigm, or the way that people should think about testing, is that there's the rapid at-home tests that are available for people to purchase, whether it's in pharmacies or pick up from places like community health centers and other community locations, and also that the White House is shipping directly to residences through covidtests.gov. Those are the at-home rapid tests. And so that's one type. The other type is kind of a laboratory-based test called a PCR test. And both tests are somewhat complementary. The rapid tests give you a result in between 15 to 30 minutes, depending on the product. And those are really highly effective in terms of giving you a sense of whether or not you have COVID, particularly if you have symptoms. And so that's the reason those are so widely available. I think the PCR tests that folks take, the ones that are laboratory-based, are actually more specific. So they're a little more sensitive in terms of picking up whether or not somebody has COVID-19. And so they're better at diagnosing COVID-19, especially if folks don't have symptoms, but also they remain positive a little bit longer. The two tests are looking for different things. So the PCR tests are looking for genetic material specifically, whereas the at-home rapid tests are looking for viral proteins. So they're looking for somewhat different materials, but they're complementary in nature. And so when people should take one versus the other, certainly if you feel like you have symptoms, you can go ahead and take a rapid test. It's going to give you a good sense of whether or not you have COVID-19. Sometimes if you're going into hospital settings, you can get a PCR test, or if you don't have access to an at-home test, the PCR tests are also available for you. But I would think of them as two complementary tools in giving you a sense of a diagnosis for COVID-19.
On that note, Dr. Webb, is there one test that you think is better than the other?
I don't think so. I think the way that I would view it is they're complementary. I work in the hospital taking care of patients, and for my hospitalized patients, they're getting the send out or the laboratory based PCR tests. But when I'm at home, or if I have a family member, like just last week when my daughter had some symptoms, we used a rapid at home test, and it gave us an answer. And in fact, we used the rapid at home test first, and that told us it was negative. And then before she could go back to school, she had to get a PCR test, and that came back negative as well. And so we got the first answer, which was great, but the school required the PCR test. So again, I think they're complementary. I think some of it is figuring out where you can get access to a test as soon as possible. That's the important thing, because sometimes getting a diagnosis can be really helpful, because depending on your risk, if you're at risk for severe outcomes with COVID, getting a diagnosis of having COVID is important, because then you can get access to some of the treatments like the monoclonal antibodies or the new oral antiviral pills. That requires that you have COVID-19 diagnosed, and then you can get into that path of getting the treatments you need to keep you safe. So I would say whichever test you can get to as quickly as possible is the one that I would use.
Okay. Dr. Shapiro, I'm sure you've given a lot of these tests. Looks like you're at the hospital right now. Can you walk us through how people should administer this test, any best practices if they're doing it at home without the help of a doctor or medical professional?
Well, first of all, and it sounds really weird, but make sure a couple of interesting things. They usually come two, and it's not because they are very awesome and they want to give you two and it's better for no, actually they do two because that means that it's for one person, and it actually adds up. And you will see on the instructions how sometimes because it's rapid, it's awesome because it's very hard at the beginning, the same way as Dr. Webb noted. It's very hard at the beginning to distinguish if it's a cold at the beginning of allergies or influenza or COVID-19. Then it's very important to understand that part. Usually you will have a couple of things that are very common for all this stuff. There's something called instructions. It's extremely important that we read this. And I make it a little bit funny because sometimes we just go drop and we start like putting everything and it looks like a science fiction thing and we feel that we're in high school again. But it's extremely important to read all the instructions. Why? Because we're sending a lot of this rapid tests in different types of boxes, different companies, and all of them have the little differences between them. Then that's one of the important things. The other thing is that a lot of them actually have a QR code. Some of them actually have for other languages. And if you need Spanish, most of them will actually ship a Spanish and English pamphlet. Then make sure that you're reading it. You have a QR code over here that you can actually go. There's sometimes videos and other stuff. Then make sure that you feel comfortable and there's no rush. Yes, it's a rapid test, but that doesn't mean that you need to finish it in 5 minutes. Then make sure that you get adequated with everything else that you have. They usually come, and I have here with a little plastic thing, and put it stable on a table. Make sure that you wash your hands. Make sure that the area it's clean, nice. And usually you have a couple of other things that come with it. There will be the famous test. There will be the famous Q-tip, and of course, a couple of them have or some type of liquid that you're going to be using, and that actually will help us a lot. Then the first thing first, make sure that you're using the Q-tip, and all of them have a different technique, if it's 5 or 10 or whatever movements that you need to do, but make sure that you go inside of your nose. And I'm going to the in front of you because a lot of people are deadly afraid of this. And I promise you, it's not the most comfortable thing that you're going to do in the entire day, or you're going to do it for fun, but at least you can actually do it and you can do it yourself. Then make sure you're putting inside, and you can see this is actually real stuff. It's actually inside of my nose, and I can actually talk, and it's actually going, a big, probably more than half an inch there. And you go and do a round, and you try to get as much snot as you can. Yes, it's not the most joyful moment. Yes, of course not. But you repeat it twice in both sides, and a lot of them actually have the little place with the liquid stuff. You place it there, you mix it, and it tells you how many seconds and that stuff. And I'm going to just jump over here. At the moment that we have this thing, it's actually mixing with a special sauce that will help actually the testing thing that we have here to see if it's working or not. Then having that, you will need to drop a couple of drops in your test, and my test is very white. Then you see here, there's like a couple of places. You have here the place that you will see actually the lines. It's very common and very easy to use it. And sometimes we get panic attacks because it looks like a pregnancy test. It's not. Then it's very important that just to drop a couple of drops here, but it needs to be like this and not moving. Then make sure, because a lot of times it's like, oh, I did it, and you're jumping and doing that. No, don't do that part. Just make sure that you have it. You can actually use your tray for that. You put it on a special tray, and you do the drops, and you just wait. On the waiting time, you will have a lot of thoughts. You will reflect a lot of using your mask, making sure that you're vaccinated, and all your stuff, other options that you have out there. But it's very important inside of the pamphlet to read the codes here. Each test actually will tell you what colors you have, and you have 3 options. Option 1 is it's yes, you have it. Take care of yourself. Take care of your loved ones. Follow the protocol that you need to follow. The other one is like, right now we didn't detect anything. You're clear. And sometimes you get that one that it's I have no idea if you have it or not. Maybe there was too much sun, or there was not enough snot, or whatever. Then that's why it's important the second test that you have there. Then you can repeat it a couple of hours afterwards, depending on the protocol that you're going to be using. And, on the pamphlet, it tells you what's the best thing for the test that you're using. And practically after 10 to 15 minutes, depending on the test, you will get the results. And I'm going to share with you my results from this morning. And I'm free from COVID, at least right now. And you can actually repeat that part. And the important thing is that Dr. Webb noted this, that it's for our protection, for our family protection, for our coworkers, for our schools, for our teachers. That way we do not need to be, losing another day of work or moving from one place to another. And at least we have another piece of information. But remember, please, 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 these tests they are part of, and I call it like an FBI agent. It's part of the puzzle. Then if your entire family has COVID, you're having symptoms, you are having, you're not smelling, you have no taste, you're feeling horrible, you have fever, you have cough, and any test comes negative, most probably you have it. And make sure that, yes, it will help us, but it's a piece of that puzzle that we have out there.
That makes sense. And I bought a test for the first time at a local pharmacy just last week, actually, because my daughter wasn't feeling well and I wasn't feeling well. And I did exactly what you're saying. I panicked. I opened the box really quickly. I tore half the instructions. I was I just so panicked. And what I thought, because it comes with two, like you mentioned, was that, oh, one for her and one for me, right? I didn't realize that one box with two tests is for one patient. So thank you for clarifying that. I have a question, and anyone can jump in here, because I've noticed that there are certain states where the insurance is required, the health insurance is required to pay for or reimburse the test. I don't think that's across the country, but you can correct me if I'm wrong, Dr. Webb. Can you walk us through that and what states, so people understand that they can file a claim if they save their receipt with their insurance?
Absolutely. And thanks for raising that. Such an important piece, because a lot of people pay attention to covidtests.gov and they say, well, I can get 4 tests sent to me from the government, but what if I need more tests than that? So the rule went into place on January 15th, and it actually says that all private insurers have to offer 8 free tests per month per insured individual. Now, if you keep in mind, over 50% of the population has private insurance. It's about 46% of the Latino community, but overall, that's a lot of people who are able to get these 8 tests per month per insurer. The thing is, not all insurers are doing it the same way. Now, we've asked them to make it as easy as possible. I would say about 50% of insurance companies are making it free for you to get those tests at the point of sale. So in other words, they tell you, this is the pharmacy where you can go pick it up, go there, show your insurance card, and collect your 2 tests, and that's how they're doing it. There are other insurance providers who are requiring you to pay for it and then submit a reimbursement. And so I think the first thing to know is what your insurer is doing if you have private insurance. Now, what about everybody who doesn't have private insurance? Well, Medicaid is also offering these tests, but that's kind of to your point there. Medicaid is required in all states to offer these free tests for individuals, but how they're doing that varies. And so we're having a lot of conversations with different states to make sure they make it as easy as possible for people. And the last piece is Medicare, because we know some of the population is also on Medicare. And for those individuals, the announcement just came out this past week that by the spring, they'll also be doing the same thing, offering these free tests to individuals as well. So it should be something that's available to everybody, no matter what kind of insurance they have. But if you notice you're running into some problems or some challenges with that, particularly if it's with Medicaid, then I would say reach out to your local public health department, and they may be able to help you navigate.
That's really good information. When I actually went to buy my test, I paid cash, and this is exactly why we're having this webinar, because I thought, let me save my receipt somewhere, but I thought I heard that in the news and I wasn't sure. So I'm glad that you're clarifying that. And I think, the employees at certain retail pharmacies should also be, asking folks for their insurance card. So hopefully some more outreach can be done there, because I certainly wasn't. President or CEO Benavides, I wanted to ask you a few questions. Our community, the Latino community, as well as the African American community, were hit disproportionately hard with COVID and continue to do so. vaccination rates are better. But I wanted to see if you could just walk us through the current landscape of COVID in our community in testing.
Thank you so much, Marcela. And first and foremost, muy buenas tardes, good afternoon. Thank you so much to everyone for joining us, Dr. Shapiro, Dr. Webb, as well as our council president, Ed. Thank you for being on from Washington State. And, what I would say, first is that as we think of the Latino community, and a lot of Americans did not understand why there was that increase in terms of Latinos getting COVID. We have to be mindful that 5 out of 6 Latinos have to leave their houses every single day to work and get paid. We are the essential workers of America. So many of our community members are exposed to COVID because they're working not only in the health industry, they're also working at those supermercados, they're working in the schools. And so we have to understand the vital role that Latinos play to make sure that our economy keeps moving forward. I would also say, Marcela, that, we are very thankful and we congratulate the president and Dr. Webb as part of the White House for the excellent work that they have been doing. 1 year later, over 210 million Americans are vaccinated. And when we think about the starting point, right, a starting point that was very polarizing, a starting point where wearing a mask was politicized, I think it's so important that we understand the challenges that so many Americans face across the country and the work that it has taken to combat disinformation when it comes to the vaccines, right? And we know that disinformation is rampant. Sometimes we may get a video via WhatsApp or a link to a YouTube video with no source, and the information is completely infactual. And we know that so much disinformation is happening in Spanish. This is certainly something, Marcela, that LULAC is addressing with so many of the social media platforms, making sure to flag, obviously, for the White House, for members of Congress, because we know that unfortunately our Latino community is being targeted. And as I think of our Latino community, the truth is that we're still behind, and making sure, Marcela, that we have that access. What a lot of people don't understand is that when we first started seeing the signups for the vaccinations, I remember having to do it for my parents. And as I sat there with my 2 parents who are in their 60s, I honestly thought I had to become a medical doctor to understand some of the language that was being put on the website, and English only. So you can only imagine for a part of our community, which is Spanish dominant, trying to understand 6 to 8 to 12 pages to get to the end, to be able to register for an appointment to get a vaccine, it was close to impossible. Not to mention that on top of that language barrier, you also have 1 in 3 Latinos who do not have access to technology or broadband. And so if the only way to access a vaccine was through an online portal, we were missing 1 in 3 Latinos in our country. And so for us, Marcela, it was really jumping into action. I just want to give a shout out to our entire programs team, Sandra, Jennifer, Melissa, Priscilla, because they're really behind Vacúnate Hoy, or Get Vaccinated Today. And they have been working endlessly since the pandemic started with our councils, presidents like Ed out of Washington State, and council presidents across the entire country, including Puerto Rico, to make sure that our LULAC members were getting that awareness, that education. Just to give you a general sense, Marcela, we've been in many conversations, and as you know, we're a grassroots organization. We are in the community. We are the community. We have as young as 12 years of age who are LULACers, and our oldest member is turning 102 in April of this year. But just to give you a sense, we were in contact with Walgreens and so many of other partners in terms of the pop-up clinics, right? Like, let's think outside of the box. How do we go to our community and meet them where they are? And it was the pop-up clinics, the canvassing. Our councils alone spoke to over 10,000 people, and they were able to vaccinate over 2,000 community members. This is just LULAC. This is just our LULAC councils. But more than that, when we started tracking the data, right, and we know that data is very important, over 65 of those conversations translated into the individuals actually getting vaccinated and making that decision. So we know that that close touch, and yes, wear your mask 6 feet apart, matters, right? Like making sure that we're having esa conexión con nuestra comunidad es tan importante, and also being present in over 24 states and having those pop-up clinics, again, meeting the community where they are. We also know, Marcela, that we have to layer this, right? Like it's not a one-time type of communication. And with our strategy, it was, one, the communication side, reaching over 12 million Latinos to make sure that they understood, get vaccinated, get vaccinated, get vaccinated, make sure you're checking your sources, get vaccinated, get vaccinated. Don't trust, videos with no sources on them, get vaccinated, get vaccinated, get vaccinated. And then shifting obviously to the boosters and continuing, to beat the drum on wearing your mask, social distancing. And as parents, and I'm a parent of a 4 and a 6-year-old. So Dr. Webb, I get those scares all the time. Marcela, I completely understand what you're saying when, you see your child with a sniffle. It could be allergies, it could be COVID, it could be anything. And so, for us, it's really jumping into action. And I'm happy to tell you, Marcela, that, as the numbers continue to increase for the Latino community, there's still work to be done, right? And part of that work is really combating the disinformation that exists, particularly around the vaccinations and even now wearing your mask, right? And we've seen this throughout the entire pandemic. And then I just wanted to point out that, LULAC is part of Juntos y Podemos, which is an effort of the health department, our national health department. And we are working closely at all levels, federal, state, local, to make sure that this information gets to our community. And, I always like to do and test the links before like giving it to our community. So if you haven't gotten your test, covidtest.gov, it literally took me 30 seconds because I timed myself. 30 segundos to be able to get those free at-home tests from our federal government.
Thank you so much, Sindy. And speaking of the grassroots effort, President Rosales, can you talk to us a little bit about what you're hearing directly in Washington State from the community about testing, what questions they have? I know I got a question because I'm always out talking to everybody. So I got a question today from a woman at the gym, who scans. And so she's a, essential worker. She works there. And she said, I don't know if I should be getting tested because I'm with the public. Should I be getting tested every week, every other week, every day? I don't know. I'm scared to work here, but I don't have a choice. So I'd love maybe later on for the doctors to chime in on that. But right now, I'm interested in hearing what you're hearing, President Rosales, from your council.
Certainly, thank you. And thank you for allowing me to be part of this conversation. It's interesting when you bring up the testing part. We have many of our essential workers that have been vaccinated and still have symptoms and still have breakthrough cases. We have people that have never been vaccinated, and they all ask the same question about the testing. When should I do it? How should I get access to it? I don't understand what it's about, and do I have to do it? Part of the problem in Southwest Washington and Washington State as a whole is that we're a little bit behind the rest of the United States with almost all of it, and I couldn't really tell you why, but as soon as the testing became a more apparent issue as we were being vaccinated, there were none available. You could contact any of your pharmacies or any of your doctors, and you just couldn't get the vaccine. So once President Biden rolled out the access to getting home tests, then the questions came out again. Do we need to get tested? I've already been sick. Do I need to get tested? And the answer has always been yes. But there's a lot of lack of information that I find within our community here.
I think we can't understate the problem with the bad information. I had a high school, local high school young woman who occasionally babysits for me. And so I asked her, well, have you been vaccinated? I think it's a fair question, right? If she's going to come into my house and be with my kids. And she said, oh, no. And I said, okay, well, why would that? Why? What's the reason? She said, oh, I saw on, and she mentioned the social media network, but she said, I saw that it leads to infertility. And, one day I want to have a family. And I said, well, you can't have babies if you're dead. And so, I gave her the proper information, and I hope that she has gotten her vaccine. Clearly she wasn't hired, but I do, I think it's a real problem. She showed me, some of the links, and I think we just have to combat it. And each of us as members of the community, we're ambassadors, right? And we have to be on the side of science. without making people feel bad, but explaining to them, what's real and what's not, helping them and guiding them. I wanted to ask if you could, Dr. Webb, kind of walk through quickly the basic steps. Sindy mentioned there's 30 seconds. How can people from our community, let's say if their English is not their native language, how can people from our community get access to the tests?
So I think the first thing to do, if you have internet access, that's the first kind of decision point. If you have access to the internet or to a phone that can connect to the web, go to www.covidtests.gov, covidtests.gov. And what that does, if you go to that site, it's, as was mentioned, pretty quick and easy to use in the sense that you can go there, click on the button that says order my test, enter your name and address, and press submit. And you'll actually get these tests shipped right over to you. If you include an email address, you'll also get tracking information, so you'll know when your package is going to arrive. So that's one way to do it. And the thing is, that website specifically, the top right-hand corner, you can click the button to switch the site to Spanish. So it is available in English, Spanish, and Chinese. Now, the other option is if you want to do it by phone. Let's say you don't have internet access or you don't want to do it over the internet. We've set up a really easy to use call line that similarly helps get you these tests as soon as possible. That number is 1-800-232-0233. I'll say that again, 1-800-232-0233. Now that is a line that you can call to order your tests. It's available in English, Spanish, but also 150 other languages. And then on that site, you indicate the language that you need. And then from there, you give them your name, your address, and similarly, pretty quickly, they're able to get your tests out and shipped to you. We've had over 60 million people who've completed this process already, 60 million residences that have requested their test kits, and tens of millions of these tests have already been sent out. So not only are we getting the orders in, we're getting the tests out and doing that as quickly as possible. So you can go to the website, you can do the call line. Those are two different options specifically for this program. But again, there are also free tests at community health centers. There are also free tests at long-term care facilities, other spaces as well, and other places in your community where you can go for tests.
Thank you so much for that. And I ordered mine a few weeks ago. I didn't time it like Sindy, but I do remember it was not an invasive. Nobody's asking for your blood type or any kind of, credit card numbers or social security. It's not invasive at all. It's name and address essentially. And yes, so nobody has to worry about, getting hacked or any personal information.
And importantly, I think some people have asked, what are you going to do with this information, right? And so we've been very clear because often there's questions about immigration enforcement or things along those lines, and this information is not being shared for those purposes at all. It's really just to get you your tests. And so in the frequently asked questions, we made sure to address that because we're aware, the last few years before this administration, it made it hard for people to feel comfortable providing information to the government for fear of what may happen. And so I think it's just another way that we can try to help make it as easy as possible. We request the bare minimum information to be able to get you your tests.
Thank you for that, Dr. Webb. And Dr. Shapiro, I do want to go back to that question since a lot of the audience today, might be like the young woman I spoke to this morning, essential workers or even if they're not strictly speaking, essential workers, they work with the public, right? What is your advice for those who might not exhibit any signs of illness, but they are, in constant contact with the public? What would be your recommendation for how often they should get tested?
It all depends on a lot of things. Right now, if you're in healthcare, that's a different threshold. If you're going to school, that's a different threshold. Then I'm just going to give general determinations on how to measure your own risk. For sure, clear. If you have symptoms, test yourself. There's no clinical way at the beginning to understand if it's COVID-19, influenza, a simple cold, or an allergy. Then remember that point. The other thing is make sure that put all the pieces of the puzzle together. If you're creating and you're using your N95 that we have access to that part. If you're using your two surgical masks, that's also awesome. Then you're creating barriers between you and actually the virus. It's not against humans, it's against the virus. Then you're creating that type of barriers between you and the virus. Then the other thing is, if you're not a lot of people at the beginning were using gloves, and on reality it's more like washing your hands. It's there's a minute possibility, but look at your hands like airplanes, and the landing pads are your eyes, your nose, and your mouth. Then if you have not only COVID-19 but other stuff, influenza and other viruses, bacteria in your hands, and they land in your eyes, your nose, and your mouth, well, it could be a problem. Then that's why make sure that you're washing your hands, taking care of yourself. If you're working, a lot of the times, make sure that you try to have the windows open. I know that a lot of parts of the US, it will be kind of impossible unless you want to have like a very horrible pneumonia. Then make sure that you're doing appropriately. But the more air, the more space, the more barriers, including the mask, and of course using the vaccine to mitigate problems and complications from the virus. All of these things actually work. And I know that we have a lot of people that have different feelings, but the more barriers we create, the better we'll be. And of course, on top of that, and that's the cherry, is the testing, because that actually will not only help us, but will be also helping our community. If we're going to work and we have a sniffles, and it can give us more information on how to protect ourselves and everybody else around us.
Yeah. So I talked about buying the test 2 weeks ago. So what I ended up having to go to the doctor, and it was strep. And I thought about a lot of the things that we do, which is, highly contagious. And I thought about, and I'm sure I got it from one of my kids, but I thought about a lot of the things that I did, kind of remove myself during the few days before the antibiotics made me not contagious, are very similar things that you have to do with COVID. Do you think that COVID-19, if I hear a new normal, if I hear that term again, I think I'm going to go crazy, because everyone here is laughing, because what is a new normal, right? But do you think that, if you had a crystal ball, but from a medical point of view, obviously COVID is here to stay. It's been introduced to humans. And are we going to be looking at this in 2 to 3 years, like a flu, like a strep, like, your typical virus?
I have really good news. I do believe that a lot of people were very tired, especially right now, that, why, if we have so much advancements, why are we still having so many headaches from this virus? But, well, the reality is that if we remember our December, our first two Christmas, the 2020 period and 2021, they were horrible. We were alone. We were hiding from each other. We were not even having hope. Kids were at home, not at school. Then we had so many crazy stuff happening around us. And of course, life continued. We need to make sure that we were bringing bread to the table. Kids needed to continue learning and developing. Then it got interesting there. But right now it's different. We have three vaccines that actually work. There's a lot of places in the world that they have certain vaccines or no access to vaccines at all. Then at least we're moving forward for that part. And it's helping a lot, because we are seeing the difference at hospitals and clinics, and people that are actually getting vaccinated have less complications, less, long COVID things. And for kids, especially, all this inflammatory syndromes that we're seeing in hospitals, that, at least we have that part. And, we also have new medications that are working. Then we have a lot of other stuff that it's better. Same way with strep and other things that we had. Then if you compare what happened with influenza, the Spanish influenza, that was devastating. And right now we are advancing. We have a lot of other barriers. What's my take on this? We are at the beginning of the end of this cycle. And I don't want to call it waves, because I feel that I'm surfing, or we're reaching the peak, yes. But the same way that we're going up the mountain, we need to go down the mountain. then we need to make sure that we're still taking care of each other, because this virus actually uses human beings as the main source of production of the virus. Then if we at least make it difficult, we probably will save ourselves with a lot of headaches problems, because that thing that it's Omicron is less severe. Ask any patient that right now has Omicron, they will tell you that they had headaches, fever, malaise, and they felt horrible. It was not less severe than Delta, it was horrible. Then plus, you never know if you're the lucky one that ends up in intensive care unit and other stuff. Then we need to portray that part. And the other thing is that kids are going back to school, and we need to make sure that we are already know what things are evidence-based that help. The more barriers, the safer we are. Less barriers, we're getting close to the virus. Then I think that we're going to have a better cycles of this, better waves surfing from this, but we will have some type of vacation summer mode until September, and after that we'll need to restart this type of conversation. And remember that the virus, it's adapting to us, we're not adapting to the virus, then we still need to have our guards up.
Speaking of school, and I'm sure everybody with small children or children still in school on this call gets the email or the text message from the school district or the school saying a child has been identified with COVID-19 in your class, and of course, because of HIPAA and privacy, they don't share the name, nor should they. In fact, I think I got one 2 days ago. If you get that message as a parent, does that mean you should get, especially if it's in the child that is sick is in your child's class, should you test your child before sending them back to school?
A couple of things. That's a beautiful question. There's rules regarding CDC guidance, and each state and public health department has their own special sauce to it. In general terms, exposure doesn't equal a lot of things, because we already know that kids are doing, if they have the easy part, if they have symptoms, yes, please test them. Some of the times, if they had the exposure yesterday, and especially right now, as Dr. Webb was saying, the PCR has a perfect timing when it will actually be better for us to actually show us, if the virus is there or not. Same thing with the antigen test. And if we do it at the same day, at the same moment, without symptoms, we can do it. If we have access to it, do it. But usually 2 or 3 days afterwards, that's kind of the optimal timeline to actually that way, if it's something is cooking, if our kids are starting to have symptoms, it will give us more advantage to that point. But it's very important that if you have doubts, make sure that you talk with your doctor at that moment. We are making sure that in community clinics, in the healthcare settings, and a lot of the efforts that we have done by phone and chat to make sure that you have that conversation on what's the specific thing that's happening to your child, because it depends also with chronic diseases, who lives at home, and other stuff to actually take that to account.
Okay. So what I'm hearing, 2 or 3 days from the time of exposure is the optimal time to take the test for the best results.
Exactly, and important to actually follow up the, what's the local guidance for the testing.
Got it. Okay. So another question I fielded today as I was talking to people, like what are people out there saying, right? What are their questions? Was the question of, and I hate to use this word because it's another word that's been so played out, but fake tests. I don't know if the tests I'm ordering on Amazon are real. What if they're counterfeit? What if they're just taking my money? What if they're made in X country and they're not as good as, I don't know where these things are made. There's a lot of desconfianza. There's a lot of mistrust of testing. And I also think some of that is through erroneous information, that people are getting. Can you, or Dr. Webb, President Rosales, Sindy, walk us through kind of what is the scoop on this quote unquote fake test? Do they exist? How do people know the tests they have are real? If anybody has anything to contribute to that.
Sure, I can start. I think the first thing I would say is that the test that certainly the federal government is sending are real tests. And so all of them have received emergency use authorization from the FDA. So even though we have different kinds of test kits that we're distributing, each of the ones that we're sending, no matter where you live, has been approved by the FDA for use. So that's the first thing to keep in mind. Is there potential for counterfeiting if you're getting tests from somewhere else? There's always that potential in any situation. That's probably few and far between. It's not kind of the predominant thing that's happening here. And I think that one way that you can navigate that, because I've heard that concern in the context of testing locations, that people have been concerned are just trying to kind of get their information, and just make sure that anywhere that you go to get tested is somewhere that the local health department knows about, or that you're getting kind of referred to that space from someone you trust, a provider, again, the public health department's website or something along those lines. But some of this, as you described it, the fakeness conversation, some of it is people just looking to confuse and make it harder for people to navigate. I think people like to throw a lot of misinformation out there about what's happening. It just makes people more confused. And this has been such a highly political issue, even though it's truly a public health issue. I think it makes it harder. So I would just say, one thing that you can always do to feel a little bit safer is if you have a usual source of care, primary care doctor, a nurse practitioner, or public health professional, somebody who you're able to talk to about health issues, that's a good place to start in terms of getting directed to resources you can trust.
And I would just add to the conversation, Marcela, that the question of misinformation and disinformation is very real in the Latino community. And, part of us building that awareness and education, and I can say, even in my own household, having the conversation with my mom, who is on Facebook. She's become an expert on Facebook. She's definitely a WhatsApp user. And, my mom will say, Hija, did you see this video? And I'm like, pero mami, pero ¿quién lo mandó? ¿Cuál es la fuente? What's the source? And also building that awareness for our community to question, right? Like, who is posting this? Is it coming from a legitimate government website? Hello, the CDC, right? Like, this is something that as Americans, particularly with this pandemic, we're aware of the great work that they're doing. And so I think part of it, Marcela, is also making sure that we understand that there's a political nuance around the word fake, and that we don't fall trap into that misinformation, disinformation as consumers, as individuals, as activists, as family members, as head of households, as every title you can imagine. It's so important that we look at the source, we question even our own family members when they're forwarding links or forwarding GIFs or images that just have blatant incorrect information, right? And say like, hola tía, no estoy de acuerdo con lo que me mandó. And, like literally telling them, I am not, like, this is not accurate, because they may not know themselves, and they may be vulnerable or susceptible because someone they know sent it to them, not realizing that this is just the spread of misinformation that is just rampantly happening in our community. And remembering that culturally, we are a community that trusts by word of mouth. Right. So if it comes from a friend, if it comes from a third cousin, if it comes from our tia abroad in Costa Rica, if it comes from someone that we know in our phone list, that does not necessarily make it true. Right. So just making sure to take that step and really check those sources.
Yeah, that's go ahead.
I was going to just add to what Sindy said. The trust factor plays an important and integral role from the grassroots level. So what we tell people on a constant basis is know who you're getting the information from, and do you trust it? So we reach out to our churches that our community participates in as well, not necessarily to convince them, but to provide them with the correct information and say, if you're confused or you have questions, please reach out, because we want to make sure that the right information is getting everywhere. So wherever our community turns to for that trusted information, we just need to make sure that they're shored up with their correct information as well.
Yeah, thank you for doing that. I think, in our culture, we're storytellers. Our music tells stories. We have a strong oral tradition. And that's usually for good, but sometimes, sometimes it can, Sometimes it can come back to us. I have a question here, and I'll kick this question to the doctors. It's from Paula Plasencia, who's thank you so much, Paula, for joining us. And she asked, what extra precautions should we as school employees take in working in an environment that does not require masks and we don't know which students are out during COVID?
Dr. Webb, if you don't mind, as a pediatrician, I can take the first strike. It's extremely important, first of all, to thank you for your service, because if I have a lot of family members that are teachers, stuff like that, and it has been hard. First of all, you can always use a mask. There's no law prohibiting you for you actually using a mask. Then trying to get a decent N95. You can request them, you can get them. Right now there's a lot of pharmacies that are giving away, for qualified health centers, community clinics. That's the first thing. The second thing is make sure that there's ample circulation. Then if it's very cold, make sure that the air is actually at least moving. That actually helps. That way the particles are not floating there and staying. The second thing is make sure that, if you can, there's more space between kids and between you and the kids. That actually also works. And the other personal things that you can do, make sure that you have your booster shot in. If you have any chronic disease, because we have seen such horrible things, and like more, if I'm not mistaken, at least in California, more than 35% of teachers have some type of chronic problem, diabetes, weight problems, hypertension, that stuff. And all of those actually increase the possibility of creating complications, and make sure that you're taking care of that part. If that's the case, make sure that you're eating well, drinking well, and sleeping well. We know right now that if our body it's ready, it actually boosts the immunity, and of course helps more to increase the possibilities of the vaccine fighting against COVID-19, and of course the barriers of the mask. And those are kind of the 5 things that I suggest that you should follow, and at least that will decrease the risk that you have. Is there a magical formula that will be 100%? Sadly, not yet. Hopefully, at least we will try, but the more headaches you give to the virus to get to you, the better it will be for you.
Yeah, that's a great point, Dr. Shapiro, that, I live in a state where the school districts can't mandate the mask, but that doesn't mean you can't wear one. You won't be punished for wearing one if you choose to do so. So that's a great point. I think a lot of times the news media focuses on what certain states or what certain counties say can't be mandated, but we as individuals, as mothers, fathers, brothers, sisters, friends, etc., can definitely make our own choices, and we're not going to go to jail if we wear a mask. Dr. Shapiro, I'm also getting a request if you could put those 5 things in the chat. And for those of you, those 5 recommendations you had that you just gave Paula, and for those of you who are joining us, in the chat, there's a lot of helpful links and phone numbers for all of the resources that we're talking about, provided by our esteemed panelists today. So I had another question about the scenario of you take the test. If it's negative, it's negative. But if one of the doctors could walk us through, you take the test and it's positive. Let's say you live in a small apartment with a lot of people, family members, etc. What should you do? There's a lot of confusion about, do I quarantine? It was 14 days and it was 10 days and it's 5. No, it's back to 7. I mean, there's a lot of, as we call it, swirl, right? And so since we have the honor of having two medical doctors, if you could kind of walk us through the test, it's positive, it lights up like a Christmas tree. What should you do?
Well, I'll start here, and I've been on a couple of these calls with Dr. Shapiro, so I know he's going to bring the heat as well. And I'm just going to be straight up with you because people are dying, and there's too much at stake to not be straight up. If you test positive, protect yourself at all times and do everything you can to stay safe. A lot of people are splitting hairs over CDC's guidance and trying to tease apart 5 days, 7 days. The first thing to know is wear a mask constantly for at least 10 days. In fact, with the level of cases that we're seeing right now, today we have more cases than we had at the peak of the Alpha surge, at the peak of the Delta surge. And so even though people are trying to tell you that Omicron is coming down, we still have way too many cases in community to be walking out anywhere without a mask on. So the first thing is strictly wear a high quality mask at all times, particularly if you test positive. That should be a no-brainer. The next piece is how long do you have to physically have to stay in your home? And that's where the CDC changed the guidance to say 5 days is how long you have to. Part of that rationale is that there's data that says that about 80% of the transmission of COVID from person to person happens in those first 5 days. And so if you stay home those first 5 days and then are wearing a mask at all times those next 5 days, and the people around you are all wearing masks, it should be limited the amount of spread or transmission that's happening thereafter. If you're able to stay home longer than 5 days, stay home longer than 5 days. Every additional day that you stay home beyond that decreases the likelihood of spreading COVID to another person. Some people just aren't able to stay home longer than 5 days. And I think what CDC's guidance is saying is that, after 5 days, if you're strictly wearing a mask at all times, the risk of transmission to other people is going to be significantly lower than it would be in the first 2 or 3 days. So I think that's kind of what I would say. Wear a mask at all times for at least 10 days and stay home for sure for at least 5 days. The other piece that CDC added was you can test on day 5. So you can do one of those at-home tests. If that comes back positive, they're saying you might want to stay home for the full 10 days. If it comes back negative, that can give you a little bit more of a sigh of relief that, hey, maybe you're not transmitting the virus anymore, and you still are going to go out and wear a mask at all times. So I think the main thing is protect yourself, protect your community. Like I said, and I say this, we say it in the Black community a lot, protect yourself at all times. We got us, right? The people around you, your family, your community, that's who you're being responsible to when you go above and beyond the baseline of recommendations. So no, that's not the official CDC answer, but it's the how we stay alive in a pandemic answer.
Thank you. Thank you for your answer. You said something that was interesting. If you take the test, I'm just kind of doing a scenario here. It lights up like a Christmas tree. You definitely have COVID. And let's say you're not a salary employee, but you have a job. Maybe you're an hourly employee. Maybe you work amongst the public. What are the rules? A lot of people, especially at the beginning of the pandemic, but I still think there's a lot of misinformation of being scared about getting fired or missing days, or they need the money. They're going to fake it till they make it, especially if they're asymptomatic. What are your recommendations for somebody in that scenario? And obviously you all are doctors and not lawyers, but you work, especially Dr. Brown, in public policy. What are the kind of the rules, the regulations for employees and employers if somebody is positive with COVID-19?
Yeah, you get a different answer to that question at different points over the last 2 years. And if you remember earlier on in the pandemic, Congress passed laws that made it so that you had guaranteed time off from work if you tested positive with COVID-19. Your employer couldn't take any action against you. And that was to some extent supported by money that Congress put together from the CARES Act, so that through the end of 2020, that was available to folks. And even in parts of last year, in parts of 2021, there were also some tax credits available for employers to make sure that they're able to, to make it through if employees had to stay out of work a little bit longer. One of the concerning things is that a lot of that support, whether from the federal government and the state government, has trailed off as the pandemic has worn on. I don't think anybody anticipated being in this tough moment for 2 years. And so, I've heard really concerning reports of things like that happening. People testing positive for COVID, and I read an NPR story, somebody reporting it to their employer and then subsequently losing their job. And that's tragic. We certainly don't want to see that happening at all. We can't speak for all employers, but what we can say is our strong encouragement to employers has always been, understand that this can happen to anyone and everyone in your workplace. It's been critical to keep the workplace safe. That's why we were encouraging employers to make sure that everybody's vaccinated. For somebody disclosing that they have COVID-19 and not going to work, that's good for business, right? That helps keep your other employees from getting sick. It helps keep your business going. So you want to create, from a public policy standpoint, an environment when employers get it and they understand. But when you're talking about wage earners, which disproportionately Black and brown communities are wage earners, when you talk about wage earners and the impact it has on their bottom line, that can be really, really difficult. So in some communities, there are supports and services. I know there are United Ways all over the country who've been supporting. There are a lot of different funds. So at a local level, there are interventions that are helping. Again, a lot of the federal or state supports are drying up, which is unfortunate. And I think that's something that people should continue to engage their representatives about as the pandemic continues to wear on, is the need for ongoing relief there. But I think our hope is that, as we see cases continue to come down, people just lean into that idea that it's good for communities and good for business to give people the time they need, particularly if you can do it while it's paid.
Yeah, and I would think that if that person, if the employer is pressuring the employee to come in and they get everyone sick, well then, by punishing one person, you might have to close down a small business, a restaurant, not gas station, etc. So that makes sense. We only have a few minutes left, so I wanted to kind of do a round robin here and ask everybody for any last thoughts or any advice for anybody watching this. And also not just advice for them. Perhaps they know a lot of this information, but advice for how to guide them to be those ambassadors, like the way President Rosales is in his local community in Washington State. Any kind of training or best practices or tips, right? Because we want to reach out to our family and friends and our community members, but we want to do it also with humility. And out of love and caring, right? And so I think that's a lot of the Thanksgiving battles, I think in the last few Thanksgivings have been, certainly has been in my family, different philosophies on everything that we've just talked about. So I'll kick it to you, President Rosales. What are some last bits of advice you have for anybody watching us today about COVID-19 prevention, testing, vaccination, etc.?
I think the best suggestion that I would give to the community at large that's listening is to trust the people that you rely on for your health benefits. Rely on your family, and make sure that if you have received your vaccines, or if you have been using the testing kits, to tell others about it. So you're the best ambassador for your own community. Be sure to tell people what's going on with you if you've experienced positive or negative things with regard to the COVID-19 pandemic. And I think that has a lot more weight than anything else any of us could do, is if you tell your own family and your own friends what's going on, they'll trust you quicker than they will me.
I'll kick it to you, Sindy.
First and foremost, thank you so much to all of the panelists for joining us, to Dr. Shapiro, Dr. Webb, Ed, and of course you, Marcela, for moderating. And I would say, for us to be factivists, right? Let's make sure that as we're looking at misinformation, disinformation, that we ourselves arm our mind and our resources with correct information, and that we become that comadre, that compadre, that estudiante, the leader that we are, and making sure that we are spreading correct information, right? We now have data in terms of how COVID has disproportionately impacted Latinos across the country. We also know that if you're not vaccinated, the likeliness that you will end up in the hospital and or dead is much higher. And so for us, it's very simple. Vacúnense porque su propia vida depende de esa vacuna. We know that it's so important that for so many of us, Marcela, I know we're that trusted messenger, not only in our family, in our local community, it may be the PTA, it may be all the things that we're a part of, to really become that champion for vaccines, for the boosters, for making sure that our community is getting vaccinated.
Let's use peer pressure in the positive way. Dr. Shapiro.
Familia, we have been through a lot. It has been 2 years plus with a lot of things that we have seen. It has been hard. It has been tough with all of us, but this is not the moment to say, well, it's done. It's going to happen. Let's make it happen faster. No, this is the moment that we need to actually reflect on the reality that we have the option to make it better. Because if we all get sick at the same time right now, there will be no hospitals or anything like that. And that's the truth. if you don't care and you were like, well, I'm going to survive my COVID-19, but think about the people that can have an accident or they didn't programmed a heart attack or had other stuff. And we cannot address all the same, if we're all sick, we cannot address the same thing at the same time on the hospitals. That's a reality. I would love to tell you yes, but we don't. Then at this moment, familia, don't let your guard down. We need to be together and remember that we're fighting a virus. It's not about human to human contact. It's not about the pro-vaxxers against the anti-vaxxers. It's simply straightforward against a virus. We have evidence base right now on how to keep us safe, how to keep our kids at school in a safe manner, how can we can continue bringing bread to our tables, and most importantly, try to mitigate what could happen afterwards. And I'm sure that the next following months will be way better, but that doesn't mean that we need to celebrate. We need to be getting ready because September could be another surprise.
And last but not least, Dr. Webb.
Well, I'm still caught up on Factivists. I love that.
I love it.
That was fantastic. And just to put a finer point on it, you mentioned if you're fully vaccinated and boosted, you're much less likely to die from COVID-19 than somebody who's unvaccinated. It's 97 times more likely to die if you are unvaccinated compared to somebody who's vaccinated and boosted. You don't hear statistics like that, right? That's what makes this a no-brainer, and I think facts matter. What I would say is enter these conversations from a place of love and from a place of listening. Everybody, we're years into this pandemic. Everybody has deeply held opinions and beliefs on COVID at this point. So you can't just walk in, guns blazing and expect to change people's minds. You really have to start by listening. And sometimes a light hand is what will carry the day. And so make sure you keep that in mind. Come armed with your questions for people. A lot of times you can really tease apart why somebody is hesitant just by asking the right series of questions and then directing them to the right resources. The other thing is don't feel like you've got to get them to yes in one conversation, particularly with family members. And that's been my experience, is that it actually takes a couple of conversations and not forcing your family members to talk to you over and over again and over the course of a week. Just in the course of natural conversation, give it a couple of tries to keep coming back to it, and you'll get them there. Because what this is about is love. It's about showing people, family, community that you care deeply about them and that you want them to be here for the next series of holidays after we've had so many that have been just impacted by this pandemic. But really grateful for you all and the work that you continue to do.
Well, thank you. And that's going to be my Valentine's wish for everybody, right? In Spanish, Valentine's Day is El Día del Amor y Amistad, love and friendship. So, at Christmas, we go out and buy gifts. Maybe this Valentine's Day, you can approach gently. And I like what you said with the light hand, somebody you love or somebody you're friends with, and kind of work this into the conversation as a kind of a Valentine's gift, a gift of love and friendship for them, for their protection and their health and that of their family. So thank you, everybody. We went a little bit over, but hey, when the conversation is good, we can't stop. I'd like to thank President Rosales from Washington State, President of the LULAC Council there. Dr. Shapiro, thank you so much. Sindy Benavides, CEO of LULAC, and Dr. Webb, thank you so much for joining us, and we appreciate everything the administration has done to expedite the tests and to increase the supply, because now most of us are going to the pharmacies and we're seeing tests, and that's a good thing. Thank you so much. Have a wonderful day.